Well, good day, everyone. I'd like to welcome you to today's webinar entitled The Shift to Equality and Equity Through Direct Referrals to Parent Support. My name is Will Iserman, and I'm happy to be facilitating today's webinar. I'm the Associate Director of the National Center for Hearing Assessment and Management, known as NCHAM, which also serves as the EHDI National Technical Resource Center based at Utah State University. Today's webinar is being offered by the EHDI NTRC and will be recorded, which means if anything disrupts your full attention or participation in today's webinar, you'll be able to access it again on our website, which is infanthearing.org. in the next couple of days. And keep that in mind if there are any individuals whom you know that might benefit from today's information who aren't attending live. You can always direct them to infanthearing.org as well. I want to give a shout out of gratitude to our interpreters and our captioner today for helping make this meeting more accessible to those who may be in attendance. Excuse me. So we're going to have our presenters present for the next little while, and then when they're done, we'll invite you to submit your questions in the Q&A field, but refrain from doing that until we invite you to do so, and then we'll open up for a discussion at the end. So we are joined today by an inimitable group of colleagues from the great state of Illinois, and I will allow them to introduce themselves, but I'll hand it over to them now. Ginger, are you going to kick it off?
Thanks so much, Will. I sure am. My name's Ginger Mullen, and I'm the Illinois EHDI Coordinator. And I'd like to welcome everybody to a shift to equality and equity through direct referrals for parent-to-parent support. We appreciate the opportunity to share our experience in a safe space as we all work together towards learning and improving. Today, we ask for grace as we present. At times, we may use specific terms, and we want everyone to understand that multiple terms may also be appropriate. Two examples are, for our state, we use Guide by Your Side, but we believe the information is relevant to all types of family-based organizations. Second example could be the term hearing loss. We could also use atypical hearing or describe the type and degree of hearing loss. So with that, we'll move to our next slide, and we'll say welcome again. I'd like to introduce you to the speakers today. We have Carrie Valian, who is our Guide by Your Side coordinator, and she has been our Guide by Your Side coordinator since 2009. She's a parent, a true professional, an advocate, and a friend. As I said, my name's Ginger Mullen, and I'm an audiologist by training, and I'm currently at the Department of Public Health and have been the EHDI coordinator since 2005. We also have Gabrielle Byers. She was the Social Service Program Planner at the Department of Public Health and has recently taken a position with the CDC as a Public Health Advisor for the Center for Surveillance, Epidemiology, and Laboratory Services. And Kate Jordan, she's also an audiologist and currently the vision and hearing consultant at the department and has been part of the EHDI team for many years. Each of them may share a little bit more with you as they present. Our other Sound Beginnings leaders that are not presenting today are Andrea Marwa and Andrea Johnson. In addition, the Illinois EHDI program is supported through numerous collaborations, and the program is supported by a total of 5 Illinois EHDI Department of Public Health staff, 12 Illinois Guide by Your Side staff, and 16 Hands and Voices board members. We'd like to thank the Centers for Disease Control and Prevention and the Health Resources Service Administration for their funding of our projects. Next slide. Today we're going to address the following, which are steps in our timeline that led to direct referrals, areas that were impacted by direct referrals, and the shift in family needs since direct referrals began. Next slide. So how did we get there? Well, Illinois Sound Beginnings has been a collaboration since its inception. Originally, Sound Beginnings stood for the collaboration between the Illinois Department of Public Health, Division of Specialized Care for Children, and the Bureau of Early Intervention. But now, Illinois Sound Beginnings also includes the strong and robust partnership with Illinois Hands and Voices and Guide by Your Side. The Illinois Department of Public Health is directed by the Illinois EHDI Act and the federal grant funding, as our program is fully grant funded. Through the years, the EHDI program has strived to meet the EHDI 136 goals in a timely manner. Illinois began our pursuit of parent-to-parent support in 2005 and started our Guide by Your Side program in 2009. It took a lot of planning. We had many false starts. We relied on very specific timing, and we required a lot of flexibility to initiate our parent-to-parent support for families of children with a suspected or confirmed hearing loss. The parent voice was needed in the Illinois EHDI program to help us understand the needs of our geographically, culturally, racially, and economically diverse state. The provision of parent-to-parent support, which includes unbiased information, resources, and one-on-one support by trained parent guides, was the beginning of our family-based organization and the state's collaborative journey. Since 2005, at least annually, both programs have reviewed goals of both the state and the family-based organization. Each entity has needs which have to be met, and we need to listen to one another. Collectively, we wrote up numerous proposals, goals, activities, and justifications. Unfortunately, not all of them were used, but we were prepared, and we also solicited for additional collaborating partners. When our program began, our numbers were fair, but they dropped in the early 2010s. We had trouble with sustainability as well as widespread reach. The EHDI program has had increasing programmatic demands, but we also wanted to retain our commitment to parent support. As a partnership, the two entities have had to pivot many times together and come up with atypical solutions to keep the program viable and expand our reach to all areas of the state, as we'll explain later. You can read more about our activities and some unique ideas in our annual reports that are posted on the Department of Public Health's website. But today, we're going to highlight our direct referral project, which has significantly impacted our journey towards equity for all Illinois families. Next slide, please. It's also important to remember that sometimes the right people need to be at the table. Sometimes you have to wait for someone to retire or move on before you present an idea again or again. Also, you need to have ideas ready to respond to opportunities on very short notice. Writing up ideas, even in a rough draft form, will help you embrace time-sensitive opportunities. Next slide. Opportunities often come from hallway conversations with people who have related missions. You always have to keep in mind what each side can gain from the collaboration. Just because something is needed and could improve outcomes for everyone everyone has to feel like they're getting something for their efforts. This buy-in has to be sustainable and allow those involved to maximize their efficiency and resources. We need to have honest conversations about what both entities define as their mission, what boundaries exist, and what funding requirements exist. In a time of limited bandwidth and resources, we have to be innovative so that our efforts can be scalable and sustainable. Single idea programs can't survive in the current environment. Next slide. As I stated, the Illinois EHDI program is grant funded, and we're responsible to those funders. We must maximize funds by leveraging resources and partnerships. Illinois Hands and Voices Guide by Your Side currently receives grant funding from the Department of Public Health to complete a detailed and time-locked work plan with itemized deliverables. Activities go beyond one-on-one support and include the inclusion of parents at all stages of the EHDI program. For activities that fall outside of the EHDI scope, Hands and Voices provides funding for those activities. Hands and Voices has other funds due to their great fundraising activities and their community partnerships. Next slide. We can't talk about family support without mentioning FEHDI, or the Family EHDI Project. HRSA created the EHDI objective to increase by 20% from baseline the number of families enrolled in family-to-family support services by 6 months of age. At the time of the initial funding, definitions for family support were defined at the state level. A grassroots work group was formed to identify data elements and create definitions for enrollment in family support so that objective progress can be reported universally. In addition to definitions, a data entry form was created to assist in pulling child-specific data from EHDI systems. Standard data collection across EHDI programs is vital to improving the EHDI system and meeting the needs of families we serve in an equitable manner across the country. FEHDI definitions and information can be found at infanthearing.org or contact any of us. These data points are critical to making success and progress, and I'd like to read you a quote from one of the FEHDI participants to underline the importance of people coming together for mutual gain. The quote reads, "I felt a sense of unity as we all came together to discuss parameters and definitions. It was refreshing to be part of something that could make reporting not only easier to figure out, but to have consistency between states. This hopefully will allow us to see across the nation how we are doing, celebrate our successes, and evaluate areas to improve. I have hope that this will bring more parent partners to the table as a part of a larger team, creating connections, developing roles, a sense of purpose, and a mindset of quality improvement." That's the end of the quote. You can see that we have to make an environment that benefits many when resources are few, but if we come together, that's easy to do. Next slide.
Hi there, this is Kate Jordan. I'm the audiologist and a consultant with the Illinois EHDI program. And today I'd like to talk to you a little bit about the day-to-day processes and then the management of the direct referrals. We began making direct referrals to Illinois Hands and Voices Guide by Your Side in July of 2020, so just over 2 years. And HiTrack, which is our EHDI information system, is a really flexible system, and it was adapted for us to be able to make these direct referrals. And the addition of this process really is integrated into HiTrack, and it's been really seamless and really very little extra work for us. It goes right along with our workflow. So this enables us to make the direct referrals and the follow-up communications within our stable and secure database versus sending a lot of emails containing private information about individuals. We don't have to include this. We can simply say, I shared a baby with you, or I shared a group of records with you, and then they're able to get into HiTrack and look for themselves. They were given access with unique user groups and tailored access. For example, certain users in HiTrack may only be able to see screening results or diagnostic results or intervention results. Some may have read-only versus editing access to HiTrack. And as new users, they went through the same training with the HiTrack help desk and with our staff as any new users would be required to do. So as far as our weekly process, as confirmed or suspected hearing loss reports come in through the week, they're entered into the database, and we house them in a to-do basket of newly diagnosed children. We check the demographics against the Diagnostic Immunizations database here in Illinois and enter a note with any other information that might be useful for calling the parent. For example, the child is still inpatient in the NICU, or the family speaks a language other than English, Spanish speaking, families can be routed directly to a parent guide who is bilingual. I quickly enter the referral into 2 places in HITRAC, and then I share that basket or that to-do group of infants with Guidebearer side and send a quick email telling them the basket has been shared. And after that, they'll have access to all of the children there. So advantages have been that this routine meets our standard of making referrals within 7 days. Typically, the Guidebearer side coordinator or the senior guide will text families within a day, and they give them a heads up that other organizations such as EI may be working from home, and they should answer calls from unfamiliar numbers, so they don't want to get stuck in a phone tag circle. And then the next day, the guide will follow up with a telephone call. And because they are in HITRAC, they can immediately update demographics and enter notes ahead of other referrals that are being made to other agencies such as EI. And that really makes smoother referrals all around. When families are contacted by the other agencies, they've already spoken to Illinois Hands and Voices Guidebearer side, and hopefully they're more aware of the process and questions to ask. And this information leads them to making informed decisions. They're also able to enter upcoming appointments. Mom might say, oh, we're taking the baby back, or put notes in about how the conversation went. And then they're able to use HITRAC for their own processes and their own letters and documentation to collect their own data. There's very little extra work, but big gains for timeliness, accuracy, and connection. All right, next slide.
So this is Carrie. As Ginger mentioned, I am a mom of 5, and my oldest was born deaf, and I'm also the Illinois Hands and Voices Guidebearer side program coordinator. So starting out, we were cautious of how many users had access to this data system. So we just started with a few users. So when someone was out maybe sick or on vacation, there was always somebody to be used as backup. And we also trained our parent guide who is Spanish speaking so that she could input data directly for the families that she reached out to. So getting started, we knew we would have plenty of data. So now having data is great, but how can you make it accessible for collection? What data points do you need to show for your progress? Well, as Ginger mentioned, it just so happened that we were starting our direct referral process by participating in the FEHDI project. Being on the forefront of the FEHDI definitions and data collection points was really helpful in that we knew what was going to be recommended to the CDC to consider for future parent-to-parent support reporting. So we built those data points into our database in HITRAC by creating a custom form that we would input those data points onto. We copied this process, creating special forms for each of the different specialist roles as well. The next step after knowing what data we needed to collect was having a way to store it and having a way to store it and then having a way to collect it. So we created a custom letter in HITRAC that we would populate baby information onto when we received those referrals. This custom letter became our intake form. We have additional fields on it that are empty that we complete as a family is enrolling in the program. And then after a family enrolls, the additional information is entered into HITRAC by one of the Guidebearer side program users. So if you're a visual learner like me, then this graph is a great way for you to see the timeline of how things moved along and the order of our process. And things did move along pretty quickly, but we always kept in mind that we wanted to have our ducks in a row before rolling out, even if that would have meant pushing back our start date goal. Our start date goal was July 2020, so we could start fresh at the beginning of a quarter. By July 20th, we were ready and we started receiving those direct referrals. I would reach out to those that referred and then complete the intake if the family chose to enroll in our program. This allowed our program to limit the number of people trained in HITRAC, but it was also how our process was handled before our business agreement and direct referrals. I'll share at the end more about the specialist roles mentioned here at the end of the timeline. So now we're getting to the fun part of the presentation, Gabrielle is now going to share some interesting data to show the impact that our direct referrals have had.
Sure. Hi. So this is Gabby. I'm a program planner with Illinois EHDI. So as Carrie mentioned and my other teammates have mentioned, we have discussed so far how we got started and the processes that we've created. We'll now look at some data and visualizations to really help show our impact of our partnership and what we experienced. So briefly, our partnership has allowed for all families to have an opportunity to receive support. It's helped us to meet national benchmarks for parent-to-parent support. It's increased parent education regarding early intervention, which has led to improved enrollment in Guide by Your Side and early intervention. And we've had some new roles that have been piloted and resources created to help meet the needs of families. For comparison purposes, the next couple slides will show data before and after direct referrals. Before direct referrals, the time frame is July 2019 to June 2020, and after direct referrals is July 2020 to June 2022. Next slide, please. So among the many changes since our agreement started was the ability to reach more families across the whole state. Our reach wasn't limited to only serving those whose providers chose to share information about parent-to-parent support or refer the family themselves. As you can see from the map, which is colored per Guide by Your Side region, we were able to reach every corner of the state after direct referrals. And this is only because of the direct referrals from the EHDI program to Guide by Your Side. And just to provide a quick example, if we look at the before Illinois map, you can see that no families were reached or enrolled in the blue region or the southernmost region of our state. And if we look at after direct referrals, we've been able to enroll 21 families since our partnership started. So we're really continuing to expand that geographic reach across our entire state. Next slide, please. The agreement also improves racial equity as it allowed Guide by Your Side to reach out to every family. This in turn strengthened family empowerment as they had the option of pursuing parent-to-parent support. Comparing before and after direct referrals, this graph just shows that after direct referrals, parent-to-parent support has been able to be provided to more racially diverse families. The greatest change that we've seen so far has been in the Black, African American, and Hispanic, Latino, and Spanish families. Next slide, please. We suspected in years before our agreement that providers would pick and choose who they would offer parent-to-parent services to. The previously referred families would always have a really complicated situation, a communication barrier, or their child's hearing was more severe, warranting more support. This graph just shows that as our partnership continues, we're really able to reach infants with a variety of losses. And just to show, so that gray area, the gray part in this chart represents the year of 2020, the peachy color is 2021, and the black is 2022. Next slide, please. Similar to these findings of the type of loss is degree of loss. So this pie chart just shows that before direct referrals, about 5% of the infants that were enrolled in Guide by Your Side had a mild hearing loss, and the rest of this pie chart was split between that profound and moderate. And after direct referrals, we were hoping for more of a shift, and if you can go to the next slide, you can actually see that after direct referrals, our pie chart has a much more equal percentages for the different degrees of hearing loss. So our partnerships allowed us to offer services to an infant population with a larger variety of degrees of hearing loss. Next slide, please. So this far, we've discussed location, our BIPOC communities, and hearing loss type and degree. We're going to switch now and just talk about some enrollments. So funding from HRSA stipulates that we strive for enrollment in parent-to-parent support services when the infant is no later than 6 months of age. Because of our partnership, we've been able to connect with families much earlier than before. This is shown in the charts as most infants after direct referrals were referred to parent-to-parent support and enrolled in parent-to-parent support in that birth to 6 months of age category. And if you just compare that to the before direct referrals graph, it's just a complete flip because before direct referrals, the majority of infants were in that 2 years and older family. So we're working towards reaching families sooner and sooner. Next slide, please. And just to share some enrollments per year, so in 2020, 121 families were enrolled in Guide by Your Side. In 2021, 161 families were enrolled, and in 2022, 83 families were enrolled. And this only represents about half a year's data collection, so we are on target to exceed the 2021 enrollments for this current year. Next slide, please. Early on in our agreement, we quickly realized that because we were serving infants much younger in age than ever before, that families were still learning about and navigating appropriate services. This graph shows what knowledge the family had of early intervention before and after direct referrals. Yes is that the families were aware of early intervention services. No means the family did not know of early intervention services. Pending means that they've received a call or paperwork but have not moved forward from there. And aged out means the child was too old for services. And you can see that this chart shows a dramatic difference in families in the no and the pending status before versus after direct referrals. There were essentially no families in those categories before direct referrals, and after there's a large chunk in them afterwards. So because of knowing this information, our intakes have changed. So intakes have been focusing on explaining what early intervention is, the process to receive services, the roles of providers, and helping families connect to their local offices. Next slide, please. So how are we doing at meeting the HRSA national benchmark of providing parent-to-parent support no later than 6 months of age? So before direct referrals, only about 12% of our families were reaching this national benchmark. And after direct referrals, we've hung around about 67 to 68% of families reaching this national benchmark, which is really amazing to see. Next slide, please. And just to conclude with some quick stats, because we were able to reach families earlier, it was really great to see that 95% of families enrolled in Guide by Your Side between the years of 2020 and 2022 became enrolled or were pending enrollment in early intervention as well. The average age of the infant at Guide by Your Side enrollment after direct referrals is 6.8 months. And as I mentioned earlier, our partnerships also allowed us to create new parent resources, and 17 new ones have actually been created, which Carrie will now go into more detail about.
Hi, this is Carrie. So as Gabby mentioned, another activity or other activities that we've been able to do since our business agreement is to really engage the parent voice early on. And I'll start by sharing through our focus groups. We've assembled diverse groups of parents to gather feedback on the resources that we use, program materials, and websites, in addition to discussing the intake process and messaging used when serving families with children who are deaf and hard of hearing. Another product of our agreement were our snippets. Serving families younger meant that they were just beginning to process and understand the diagnosis. After seeing this week after week, the idea of creating a simple one-page handout with brief bullet points on a topic and QR code links to take them to additional learning was born. When deciding what to call them, the idea of a snippet of information came to mind, and therefore our acronym, because we can't have too many of those, simple and informative parent-to-parent education tools. So we've shared how families were impacted by our switch to direct referrals. But how did this impact our team? One of the impacts, the biggest impacts that we had, was understanding equality, equity, and justice, and being able to have honest and open conversations on how to improve from where we were. And this ended up leading to another new role within our team. This role is our Diversity and Equity Infusion Specialist. Earlier this year, Lydia and I discussed her desire to be a larger part of our program and wanting more of a leadership role. The timing was perfect, as we had just hired on more Spanish-speaking guides so they could serve the Spanish-speaking families that we enrolled. We also needed support, though, for referrals that we received where English, Spanish, or ASL wasn't their primary language. Our Diversity and Equity Infusion Specialist provides ongoing technical assistance and resources at the national, state, and local levels to the Hands and Voices Guide by Your Side team, EHDI personnel, and supporting partners for the improvement of community outcomes within disparate populations while protecting the privacy of families. Lydia has shared a quote of what it means to be in this role. Being a first-generation Mexican-American means more than a language barrier. Culture, ethnicity, patience, and representation matters. Underserved communities need and deserve equal resources. So I mentioned earlier that snippets were created from the needs of earlier diagnosed families we were serving. We're going to dive a little deeper into what our team experienced serving families before direct referrals and then the shift that had happened after the direct referrals were in place. The first shift was that the families we were serving had babies. Sometimes they were less than a month old, and the family was potentially just told about that diagnosis the week before they spoke with me, which often made us the first point of contact outside of the audiologist that they were gathering information from to understand the diagnosis and the next steps. Because of this, you shouldn't put a time limit on that initial call. Listen, let them share, and don't forget to be that parent. Remember what it was like and how overwhelmed you felt after your child's diagnosis. I can't tell you how many times I've heard from a family, I don't even know what I need to know or what will happen next. I connect by saying how I remember feeling the same way myself, but that's what we're here for. By talking to another parent who is a little further ahead in the journey, they have a safe place to ask questions and understand those next steps. I also encourage them to keep asking. If there's something that they asked, but they're still unsure about, or maybe they forgot the answer, that they shouldn't hesitate to ask again. It is all new, and it may take some time to get comfortable with. What I also found is that they are unsure of who does what and what their baby's hearing test results mean. I ask if I can send them information by email on some of the resources and organizations that will be reaching out to them so they can better understand why those providers are calling and how they might help their family. By walking the family through what to expect next, we are also able to share what is typically appropriate for recommended providers for a child who is deaf and hard of hearing, but also what to do if they don't hear from them, that when they should be reaching out. They realize that their guide is just more than a person to chat with. It is someone who can help them understand services that are available to them and where to turn when you receive mixed messages. In the past, when we were an opt-in program and not receiving referrals directly, we would primarily get referrals of complex families, severe losses, and potential cochlear implant candidates. Not that those are a bad thing, but I really think providers only offered services to those that they felt would need support rather than informing all families about our services. So after our direct referrals, we obviously saw a huge variety of hearing differences: unilateral, mild, microcereatresia, conductive, and so forth. After experiencing this shift, we saw the areas where our Guide by Your Side team didn't have that direct experience. And although they had training and resources to share, we knew we wanted to consider possibly updating our trainings or adding to the team in some of these areas. When our program was an opt-in model, we typically matched families with a guide in their regional area. Now we are finding that the regions really don't matter as much, and we tend to match more based on the diagnosis, additional health concerns, and the ages of their children. Before direct referrals, we saw very few requests for support to families where the parents were deaf themselves, or they spoke languages other than English or Spanish. Since we receive referrals for all families whose child has been diagnosed as deaf or hard of hearing, we've had to work out how to serve families who spoke other languages. Also, I want to point out that we have connected with more deaf parents in the last year and a half who have had a child who was diagnosed as deaf or hard of hearing than we had in our entire 13 years of our program. And there are two reasons why I believe this has happened. The first, all families are now referred to us. Providers don't assume that since the parents are deaf that they don't need support. The second reason is that for those where I see their primary language is ASL, I have our parent guide who is deaf reach out and explain what our program is, and then complete the intake if they want that ongoing support. We find that the family feels comfortable communicating in their own language and supported in their choices. What we also found was that in helping families early on in their journey, it prepared them to pay it forward. In fact, in our most recent call for applications, 83% of those that applied previously had worked with a guide, compared to 64% of applicants in 2020. The beauty of all this is that they have experience on the other side of the table. They have had a sneak peek of the role of the guide. And I think that with this lived-in experience, the applicants have a better understanding of the role and it prepares them for what to expect, which increases our retention of the guides. We've also had many of these newer families apply to be part of our ongoing quality improvement work groups. So support through COVID. And I just want to point out that all this data, all this happened during COVID. So I think that the stats and the data really speak volumes for not only the impact of this parent-to-parent support, but what a crucial time in our journey of parenting to need the support as well. So I had asked the team to share if there were any changes to support during COVID as compared to their experiences before the pandemic. They shared that there was a need for connections to food pantries, helping families navigate getting appointments, and brainstorming through the struggle of providers only allowing one person at appointments. And now that we've all had time to adjust to navigating life with COVID, I asked the guides if parent support looked the same as before COVID or if it was different. And one guide shared that the focus is shifting back to hearing loss. However, there are families who have lost loved ones or their jobs, and overall stress and support is just different now. I mentioned earlier how during our first year we explored other areas of support through specialist roles. Shortly after starting our direct referrals, we asked, what's next? I know we thought we might have been crazy, but we did, and that is when I suggested the consideration of a transition specialist. And in October 2020, one was incorporated into our program through quality improvement processes to the program partnership. This specialist follows up with families transitioning out of Part C, which is early intervention, and into Part B, which is U.S. Special Education Services under IDEA. I had concern that since we were serving families so much younger in age, that they wouldn't get referred later when times of transition happened, or that they would have the perception that if they accepted the parent-to-parent support services now, they wouldn't be able to access them again later. In addition, due to COVID, I was fearful that those families who should be transitioning out of EI would not be prepared for that change. All of these reasons prompted me to ask our Illinois EHDI team if it would be possible for us to create a transition specialist role. Our transition specialist, Jacqueline, gets a list of names every month from our EHDI team of those that will be 2 years, 6 months. She then in turn reaches out to check in with them to see if they are aware of the upcoming transition and to send them a transition resource guide, which we created to help families understand this process. This guide has 12 topic areas with a brief overview of the topic and a QR code that will take them to a vetted link with more information. The guide was created specifically to support this role and is also available in Spanish. Then came another what next moment and enter our loss to follow-up or LTF specialist. In February 21, the second role, loss to follow-up specialist, was introduced into our EHDI parent support team through a COVID-19 pilot project. Due to the impact of COVID-19, Illinois' Hands and Voices Guide by Your Side program was able to facilitate follow-up with families who did not make it back for follow-up testing after a failed hearing screen. They would reach out to the family, answer questions, provide tips to help them understand and increase the likelihood of a complete test, and provide support in finding facilities through EHDI PALS to go to for their diagnostic test. They would document their communication and results within HITRAC. This work helped families understand the importance of follow-up, but also created a connection with families, ensuring them that if the test did indeed confirm the hearing loss, that they would have support after the diagnosis. Since the initial rollout, we have tweaked the process and have dedicated one guide, who's Kelly, to a permanent role of LTF specialist. This role was really a win-win for both the EHDI and Guide by Your Side program because the parent guide who transitioned into this role was beginning to question her relevance as a guide, as her child was now older and we were serving families very early on in the diagnosis. We were able to keep on a thoroughly trained and experienced team member while helping her feel just as resourceful and relevant to the cause. She has blossomed in this role and takes great pride in her 69% connection rate with families and the amazing drop in the loss to follow-up percentage that the Illinois EHDI team has seen. And most recently, our third role, the Diversity and Equity Infusion Specialist, which I touched on earlier. The last point I want to mention is that the difference between the business approach and the squishy side of a parent approach. I believe deep in my heart that the success we've seen as a team is because as parents, we can relate and they can relate to us. Kelly's success in dropping the loss to follow-up rate is in her passion to serve and see things through, while also sharing from her heart that she also once thought that the repeat hearing test wasn't necessary. I'm not saying that our Illinois EHDI team is not passionate, because that is way far from the case, but parent-to-parent support is just different.
All right, this is Kate again, and this is a visual representation of the contact efforts made by the loss to follow-up specialist. And this data is just pulled from February to July of 2022. The reason for this small data set is that we actually had to make, or HITREC made some adjustments to our data systems so that we were able to pull this data. So that was a HITREC update that went into place in February. And so Kelly was able to contact 842 families. 59% responded and to a text or a phone call, and 60% of her responses were from text messages and 40% were from phone calls. 73% of the families had no response at one instance. And from this, we learned that it will take multiple efforts to reach families and to build trust and not to give up. And for those families that were reached and asked about why they weren't able to follow up, some of the reasons were they did not have transportation or there were scheduling conflicts. Next slide. So moving into talking about shared benefits, just touching again on benefits to both the Illinois EHDI and to Hands and Voices Guide by Your Side. Next slide. So some quick data. Text messaging was our most successful loss to follow-up contact effort. February and March were the most responsive months for the Guide by Your Side loss to follow-up efforts. And this is really interesting for us because this is right after the holiday season. And, you know, historically, IDPH has had the least luck kind of getting families who have children who have been born over the holiday season in December and January to seek follow-up. And so that was kind of a gap. So having this come in right on that tail is just more and more helpful. We've seen a drop of from 27%, a full 10% from 2020 to 2021. And the reports are still coming in. Just this morning, I entered a couple of reports that really solidified and underlined that number. Next slide. So just to quickly go over some of the benefits. During the COVID-19 pandemic, and even before that, we at Public Health, we were having difficulty meeting our 136 goals in a timely manner. Our partnership with Hands and Voices Guide by Your Side has really enabled us to reach additional families in more efficient ways. We were able to take advantage of them being able to use more modern communication methods, such as texting, which we already talked about how beneficial that has been and how successful that route has been. These are parents who are texting and calling parents. They're often living in the same community. So families are often more trusting and more receptive to messaging and phone calls from them. This raises the likelihood of parents to respond and take action. Hands and Voices Guide by Your Side gives parents the knowledge and the tools they need to make the choices that are right for their child. And because Hands and Voices Guide by Your Side are active users in our information data system, HITREC, they can provide real-time updates and enter comments. And on the flip side, they can use HITREC to track their own outcomes and data. Parents work alongside the EHDI program for growth and sustainability. They have a voice in systems development, and their honest perspectives uncover previously unknown barriers within the process. Next slide.
So I know we've shared a lot already, but we have a few remaining things to share. Next slide. Just a reminder that our journey was supported by great full-time and part-time staff as well as board members. Our leadership team consists of myself, Gabby and Kate at the Department of Public Health, as well as Carrie, who you've heard from today, and Andrea Marwa and Andrea Johnson-Stamba. Andrea Marwa is the Executive Director of our Illinois Hands and Voices, and Andrea Stamba Johnson is the current President of Illinois Hands and Voices. Each of our leadership team members have unique backgrounds and skills. By allowing space and drawing out special skills to shine, we've been able to make the most progress during the pandemic when pivoting was essential. Next slide. So what's next? Well, that's a question we constantly ask each other. Like many states, we do face changes in internal and external staffing. We have threats to funding, we have fatigue, and we have competing priorities. But thankfully, through our collaboration, we're able to leverage opportunities when barriers and threats arise. Very often, one of the collaborating partners can help to keep the program moving forward when others experience roadblocks. It takes flexibility, conversations outside of 9 to 5, and way out of the box thinking. I think Carrie receives strange text messages from me all the time saying, hey, what about this? And then we, at our meeting, discuss those ideas. Our current plans are in the following areas. First, we want to work on our website and social media. Our website's under a current total revamp. We want to increase access to parents' materials. We are in the process of revising wording on the website so that we are more culturally inclusive, and we will be translating all of our information into multiple languages. The website will be in Spanish, and then the snippets and other materials we hope to translate into the top 10 languages in Illinois. So we hope that you will steal shamelessly and share seamlessly in those. We are working on marketing and enhancing our specialist roles. We're supporting shared messaging through videos or easy-to-print handouts. We want to introduce the Fostering Joy philosophy for parents and professionals and do some of video gatherings of folks to examine that fostering joy. We also want to be sharing education for providers on trauma-informed care. In the area of continuous quality improvement, we're going to continue the health disparity quantitative and qualitative analysis, and Carrie has been phenomenal at helping us do focus groups. Our focus groups provide a space for people to provide that honest feedback, and 2 new ones that we plan to do are a Spanish-speaking and an African American or Black membership focus group. Both of these providing safe space for a unique community to provide their feedback on how we can improve the EHDI system. We're also going to do continuous quality improvement for increased efficiency and data documentation in our EHDIS, or our EHDI information system. But then there's always that sustainability that we want to address. So in the beginning, we did have a business agreement. We ended up in a situation where the players in our world had changed, and we were able to propose doing a business agreement, and our legal department helped us write that and create that between the Department of Public Health and Illinois Hands and Voices Guide by Your Side. Because we had been dreaming about it for many years, we had in our back pocket an outline of what we wanted it to include. So we were able to turn it around very quickly when somebody just said, hey, maybe we could. And we were right there with, okay, let's do it. But we want to go beyond that business agreement and have sustainability by embedding a lot of this into our administrative rules. Because sometimes even though we have MOUs, we still need to go back to our legislation and our rules. We want to make sure that two-way communication is always required with all stakeholders. We want to further define our stakeholders of who should be reporting and their responsibility and timeline in that reporting. And we want to make sure that all patient-level data and privacy is adhered to, and that security for all of that is at the most important level for all of us involved, not just the Department of Public Health, but also our vendor, Guide by Your Side, or our family-based organization. We intend to keep working on resources for families and providers, which we want to share seamlessly with everyone. We have Promoting EHDI Practices, or the PEP materials for parents and professionals. We'll continue to do the snippets, which Carrie and Andrea Marwa have given birth to that idea, and it's been hugely successful. And we also want to look at our deaf and hard of hearing guide support that we can provide in the future. So we're not done yet. We continue to say what's next because that keeps us going and moving, but it often helps us redefine our efficiency and our effectiveness to the community that we serve. So pivoting has been the key to get us through COVID, and it will continue to be the key to keep us moving forward in the challenging times. Next slide. So we want to thank each and every one of you. We hope that you'll go out to our illinoissoundbeginnings.org website, see some of the materials, know that that website is in a revamp, and we hope you'll go back often because there'll be some new things every time.
Well, this is Will Iserman again from the EHDI NTRC at Utah State. Thank you for a great presentation. We have a few minutes for some questions, so if any of you would like to pose some questions to our presenters, you can type those into the Q&A box, and I'll read each question and invite our presenters to respond. And the first question that has come in reads as follows, and it has to do with potential partnering with other established parent-to-parent support organizations. The question reads, there is a parent-to-parent program in most states. Illinois is one that there is not an established program. Is there any reason for not involving the established programs in other states? In our state, referrals are offered and done through the established program, which is parent-to-parent. Ginger or others, would you like to respond to that?
This is Ginger, and I'll ask for Carrie to join in. I think in this case, parent-to-parent program is referring to a specific program, not the generic concept of parent-to-parent. In our scenario, the Department of Public Health put out a grant that was discipline-specific, and we wanted folks that offered parent-to-parent support in the domain of deaf and hard of hearing. Carrie, do you want to add to that? Am I missing something? I think I'm missing a nuance of the question. So, Carrie, if you could help me.
Thanks, Ginger. So I agree. I believe the question is referring to a specific brand of family support, parent-to-parent programs, or P2Ps. And so you're right, we don't have that program in our state. And sometimes with those parent-to-parent programs, they're not discipline specific. So with that, we're fortunate enough to really understand the EHDI community and focus on the needs that they have as a program, and again, focus specifically on the needs of families with children who are deaf and hard of hearing. So there's the benefit to focusing with or partnering with a discipline specific. Now, with that being said, I know that there are other family-based programs who partner with their public health systems, and maybe there are more than one family-based partnership partnering with that department. So that could be something of a consideration. The only thing I would have to say is that sometimes when you have multiple partnerships, it gets to be difficult, including all of those in the process, and making sure that everyone is, working towards the same goal. So, you know, pros and cons, sharing the work, but then having more, you know, chefs in the kitchen, I guess, for lack of better phrasing at this time.
This is Will from the EHDI NTRC again. Here's another related question. Do you know of any other states who have used your state's protocols or procedures as a template for their programs?
This is Ginger. We just had the honor of being able to share this information at the National Leadership Conference in New York State last month. So all of our information is out there. We will readily share it. Of course, everything is done with federal money, so there is absolutely no proprietary. We'll give you anything we have. We think that some folks are starting to take some of the information that we've shared. We've tried to be transparent on the FBO calls that Carrie's been on and on EHDI chats that I've been on. So we're not aware of folks that are in full swing of using these ideas, but we will share anything with you. We believe in share seamlessly, steal shamelessly. So just get a hold of any one of us.
This is Will again. Another question. As you think about the expanded focus of EHDI to include the identification of children up to 3 years of age, how do you envision parents of children with late onset or later identified hearing loss receiving direct referrals to family support? And if that happens, will they be connected to families of other children with late onset or late identified hearing loss?
So this is Ginger. I can take the first part of it. Illinois state law says that any newly identified hearing loss through the age of 6 has to be reported to Department of Public Health. So we will follow our referral process that's laid out as a child's age dictates. Obviously not going to refer to Part C for a 4-year-old, but we'll continue to make all the other referrals as needed. If they come through the EHDI system, those are folks that Carrie will work with. As we said, if there's referrals that come or families need services later on in life, that's where Illinois Hands and Voices, they serve all the kids through graduation or even beyond. And they do some wonderful fundraising to be able to address those specific concerns. We also have a close connection to the Illinois School for the Deaf that is able to address a lot of concerns with their resources. Carrie, do you want to comment?
Yeah, this is Carrie. So we've had actually multiple opportunities where there was a late onset that the EHDI team was, it was shared with them, or the family came to us and found us first. And then we were able to share that information back with EHDI so that they could reach out to that audiologist and request that report. So it's worked both ways. We do serve those families as far as connecting them with a parent that also has a late onset. We are able to do that as well. And that's just one of the things that you look for when hiring for your team of parents.
This is Will. One final question and then we'll wrap it up. And before you all go, there will be a short a link to an evaluation and a certificate generator that will appear in the chat field in a moment here, if not already. If you need a certificate for today's presentation attendance, that's your way to get it. So the final question, you've shared some great data. Have you collected any data about children with hearing loss and additional sensory loss or disability?
This is Carrie. Sorry.
Go ahead.
So as part of my intake process, I do ask the parent, so it's parent reported on my end, if there are any additional needs aside from the hearing loss.
And this is Ginger. We, as part of our rebrand of our website, we are trying to do a lot more with deaf and deafblind. And we are working with the Illinois School for the Visually Impaired to come up with additional resources, because we do feel like we need to be that Lorax that speaks for the trees for both low incidence disabilities. So I hope that's an area of expansion that you'll see in the next couple of years from us as we get input. Illinois actually in their Part C system have developmental therapists specific to hearing loss and specific to vision issues. So we want to continue to partner with Part C to support both of those. And Andrea Marwa, our executive director, in another phase of her life, does a lot to do early intervention training sessions where they have a 2-day conference that's every June. So if you're interested in that for DTA development therapist vision, please contact Andrea Marwa or contact one of us and we'll connect with that. As far as other disabilities, we do rely on our Part C to help us address any
Oh, and it sounds like Ginger got cut off. Can you still hear me?
I sure can.
Oh, good. Okay. So this is Will. We're going to wrap it up with a giant thank you to our 4 presenters today, Carrie, Ginger, Gabby, and Kate. Another shout out of gratitude to our captioner and our interpreters for today, and to all of you for your attendance and participation in this today. Ginger's email is in the chat if you need to contact any of these presenters. That's a great way to do it. There's also the link to the evaluation and certificate generator you'll find there to click on. Remember, this webinar has been recorded and will be on infanthearing.org in the next couple of days. So go there, share it with others if it is of relevance to them. Thank you, everybody. I hope you have a wonderful day and enjoy the fall.